Today we're going to talk about surgical drains and the care of them. A lot of patients are confused about what they need to do with a surgical drain, so this is an instructional video as to the care of a surgical drain after surgery. So this young lady has graciously agreed for us to use her as our model after her breast surgery. She has surgical drains coming out of the breast, and it's a tube that comes out and it's connected to a bulb that collects the fluid coming out. It is important to make sure the bulb is not open. So you have to compress it and close the lid to create suction so that all the fluid is pulled out into the bulb. Every 6 hours, you want to do what's called stripping of the drain. What is stripping? You hold on to the tube coming out of the body, you pull the tubing, and there's a stretch to it because this is silicone tubing, and then you hold again and pull, and you do this until you get to the actual bulb. What is this for? You got to be careful, first of all, not to pull on the actual drain because that would hurt her. It's sutured here, but you're pulling on the stitch. So you always hold before you pull, hold before you pull, hold before you pull. The reason for stripping a drain has to do with the fact that because there's some blood in here after surgery, the drain can clog. The stripping moves the clots through the tubing and into the bulb. So it's not uncommon to see blood clots into the bulb. So people are like, oh my God, there's tissue and clots in my bulb. That's very normal after surgery. And we do this stripping to keep the fluid moving and to remove the clots from the lines so that it continues to remove the fluid from the surgical site. As a rule, we recommend stripping every 6 hours right after surgery. And as time goes on, we go to about every 8 hours or every 12 hours. And this kind of keeps the blood and fluid coming out of the surgical site, collecting in this bulb. You record it when it's more than half full, because when it's more than half full, it does not hold the suction as well. And then you record it on a piece of paper and you total those numbers for a 24-hour period, from 7 a.m. the day before to 7 a.m. the next morning. And you report those numbers to the office, and depending on how these numbers keep coming down after surgery, we will determine when it's time to remove this tube and the entire bulb so that you don't collect fluid in the breast after the tube is removed. So it's very important to keep a correct accounting of the number of drainage coming out of the breast. And that helps the surgeon decide when it's time to remove the bulb. So that's our video so that nobody's confused about the care of a drain after surgery.